Welcome to Heart Attack Awareness, the channel dedicated to helping you live longer, healthier, and heart-smart. We bring you expert-backed advice, life-saving tips, and real solutions to help prevent, recognize, and respond to heart emergencies. If you're over 60 or caring for someone you're in the right place. Now let's talk about something that could truly save your life. Heart attacks don't wait. They don't give you a warning, and they certainly don't ask if you're ready. That's why knowing exactly what to do in the first 2 minutes of a heart attack can mean the difference between life and death. Those first 120 seconds are the most critical window you'll ever have, and if you act fast, you can save your own life or someone else's. Today, we're going to walk through every moment, every action, and every decision that truly matters. Because when a heart attack hits, there's no time to think, you need to already know. So imagine this. You're sitting at home, watching TV, and suddenly you feel something strange. Maybe it's tightness in your chest. Maybe it's pressure like someone's sitting on you. Or maybe it's pain radiating to your jaw or arm. You start sweating. You feel dizzy, even nauseated. Something is wrong, but what you do next will determine everything. The very first thing you need to do is stop whatever you're doing and sit down or lie back in a safe position. If you're driving, pull over immediately. You must minimize strain on your heart. Do not try to push through it. Many people ignore the first signs because they're in denial. They think it's just indigestion or anxiety. But a heart attack can be silent and still deadly. Take it seriously. Next, call emergency services immediately. In most countries, that means dialing 911. This isn't the time to be stoic. Do not call your doctor. Do not call a friend. Call an ambulance. They have the tools, medications, and training that could restart your heart or prevent it from stopping. And the earlier they're dispatched, the more likely you are to survive with fewer complications. While you wait for help, chew and swallow an aspirin if you're not allergic. This is critical. Aspirin helps thin the blood and prevents further clotting. But don't just swallow it whole. Chewing allows it to enter your bloodstream faster. A 325 milligrams aspirin is ideal, but even a baby aspirin will help. Make this a habit. Keep aspirin with you if you're over 60 or have any heart risk factors. Now here's where most people get it wrong. They wait for symptoms to pass. They hope it's nothing. They wait too long to call for help, and they pay the price. In fact, nearly half of all heart attack deaths occur before the person reaches the hospital. That's why every second matters. Don't hesitate. Assume it's a heart attack and act accordingly. While waiting for help, try to stay calm. Panic increases your heart rate, which increases the oxygen your heart needs, oxygen it may no longer be getting. Take slow, steady breaths. Focus on your breathing. Remind yourself that help is coming, and you've already taken the right first steps. If someone else is having a heart attack and becomes unresponsive, you must begin CPR immediately. Push hard and fast in the center of the chest, about 100 to 120 compressions per minute. If you're trained, alternate with rescue breaths. If not, just keep compressing until emergency services arrive. The goal is to keep oxygenated blood flowing to the brain. Every home should have an AED, a defibrillator, especially if someone in your family is high risk. These devices walk you through what to do with voice prompts. They're safe, easy to use, and they save lives. Seconds matter. Don't waste them. Now let's take a step back. Because preparation doesn't start when symptoms begin. Starts now. Right now. Make sure your emergency contacts are updated. Keep a list of your medications and allergies in your wallet or phone. Teach your family what symptoms to look for. Practice the emergency call. Know where your aspirin is. This isn't paranoia. This is preparation, and it's smart. Let's talk more about the early warning signs most people miss. Did you know that not all heart attacks come with chest pain? Some come with fatigue, lightheadedness, or cold sweats. Others cause pain in the back, jaw, neck, or stomach. Some people just feel off. Women and older adults often experience more subtle symptoms. If anything feels wrong, out of the blue, or like something you've never felt before, pay attention. Another overlooked warning sign? Shortness of breath. If you suddenly feel like you can't get enough air, even without exertion, that can be a red flag, especially if it comes with nausea or unexplained anxiety. The body sometimes knows before the brain does, so listen to your instincts. A heart attack isn't just a medical event, it's a race against time. Every minute your heart isn't getting blood, cells start to die. That's why hospitals treat heart attacks with extreme urgency. The goal is to open the blocked artery as fast as possible, using medications or surgery. But if you wait too long to get there, the damage may already be done. That's why you should never drive yourself to the hospital. Even if you feel okay or just a little off, you could lose consciousness behind the wheel. Always call an ambulance. The paramedics can begin treatment before you even reach the ER, and that can make the difference between walking out and never waking up. Let's also talk about preventative steps, because while today's topic is what to do in the first 2 minutes of a heart attack, the truth is that the real fight starts long before that moment. Heart disease is often silent, but it builds over years. So if you're over 60, especially over 65, you must take heart health seriously. Get regular checkups. Know your blood pressure, cholesterol, and blood sugar levels. Exercise regularly. Eat a heart-healthy diet low in processed foods and high in fiber, omega-3s, and vegetables. Quit smoking. Manage stress. And don't forget the power of sleep. Poor sleep can increase inflammation and blood pressure. 2 major contributors to heart attacks. Make sure you're getting 7 to 8 hours of quality rest each night. It's also important to know your family history. If your parents or siblings had heart disease, your risk may be higher. That doesn't mean you're doomed. It means you need to be proactive. Let me remind you again, if there's even a chance you're having a heart attack, don't wait. Don't Google symptoms. Don't ask a neighbor. Don't try to tough it out. Call for help. Take the aspirin. Sit down. Breathe slowly. Save your life. Some people fear being embarrassed if it turns out to be nothing. But you know what's truly embarrassing? Ignoring a life-threatening emergency. Paramedics would rather respond to a false alarm than find someone too late. Your life is valuable. You have people who care about you. You have things left to do, people left to love. Don't let hesitation steal that away. Heart attacks can be survived, but only if you respond fast. 2 minutes may not seem like much, but those 120 seconds can be the most important 2 minutes of your life. And now that you've listened to this, you're ready. You know the signs. You know what to do. And you've already taken the most important first step: being informed. If this video could help someone you love, please share it. You might save a life.